Many times our patients will present in the clinic with secondary disc-related disorders associated with their lumbar intervertebral disc. This internal disc disruption can create pain that is many times difficult to provoke. If we don't have a clear picture from our 3D active and passive provocation tests, then we may need to try and provoke the patient's symptoms associated with internal disc disruption through a segmental flexion shear test. We're going to perform the test with the patient curled over a towel roll on the end of an elevated table, an inclined table. And I want to show you first what we're going to do with the model. With the patient curled over this table, they'll be in a flexed position. We'll place our thumb on the caudal dorsal aspect of the spinous process. That'll give us a nice, firm, localized contact on the process. Then we'll follow it with our mobilization hand over the top of our thumb in this fashion. In this position, we're going to give a pressure and consequently a shear in the direction of ventral cranial, this way. And in so doing, we're going to take the segment and shear it in a flexion direction. So, to perform the test, I'm going to ask my subject to stand with her pelvis on the edge of the table. I'll place the towel in the front of her ASISs, and now I'm going to ask her to curl down over the towel, allowing her knees to flex. By allowing her knees to flex, it accentuates the flexion in the lumbar spine. Then I will begin in the upper lumbar segments, place my thumb on the caudal dorsal aspect of the spinous process, and now my mobilization hand will be over the thumb, and I'm simply going to give a cranial ventral pressure, oscillatory pressure to the spinous process. I can also add gentle overpressure. Then I work my way down to the next lumbar level here, and once again overpressure. I'll do this all the way down the lumbar segments, attempting to provoke a facsimile of the patient's symptoms.